this is what an average period looks like. We've got about 30 or 40 mils of blood in here. Then next to it, we've got a heavy period, which is scientifically anything over 80 mils is considered heavy. So that's slightly more than double what the average period is. And then next to this, we have got two recent participants that have come in, and this is what one of our participants has lost in just one period. So that is more than you're allowed to donate in blood, and she'll be losing this every month. So you can understand the implications of losing that amount of blood every month chronically is going to deplete your iron levels and lead to anemia and all kinds of complications.
As shocking as that video is to see the amount of blood loss that women have, to me as a doctor, it doesn't come as a surprise. My clinics are full of women who are affected by heavy, painful periods. In fact, millions of women around the world are. I'm Dr. Nagat. I'm an NHS GP and the ambassador of Wellbeing of Women, a charity that looks at reproductive health for women and girls around the world. In fact, this year we did a campaign called Just a Period, because too many times women are fobbed off by saying it's just a period by healthcare professionals and also by research as well as work-related situations. But the fact that a woman might be crippled in some circumstances going to work, the fact that she isn't able to provide for her family, missed school days, being able to participate in activities of daily living, that this has become a norm by us saying it's just a period, is something that we can no longer put up with anymore. On average, some people are losing about 30 to 40 mils of blood. That's about half a cupful. Now, for some, it might not sound so much, but for others, it could be enough to put them into having anemic or anemia type symptoms or low blood loss, which puts them into having symptoms like fatigue and exhaustion and tiredness on a monthly basis. A woman bleeds every month for 12 months a year, for an average lifespan of up to about 40 years when she starts perimenopause. And that's when also you can get heavy blood loss as well, because as your body is going through the transitional phase of perimenopause to menopause, which is 1 year without a period. But always we must be looking at the underlying causes of heavy menstrual bleeding. Any bleeding that is significantly impacting on your quality of life needs to be investigated by the doctor. One of the things that we've just recently trying to highlight is uterine adenomyosis. That's when cells grow into the muscular wall and you get heavy, painful bleeds. We think it affects 1 in 10 women, but can take a long time to diagnose. The other reason why you could get heavy, painful periods, so pain is usually a significant factor, is endometriosis. That's when cells similar to the lining of the womb get deposited outside, causing endometriotic lesions. This can cause severe pain and on average can take up to 8 years to diagnose those who are affected by endometriosis. My youngest that I'm diagnosing by symptoms alone are around about 14 to 15, because actually you're not too young to have the diagnosis. When it's missed, it can affect the fertility of some of my patients. That's why early diagnosis is so important. As much as I'm really happy that the government is pledging more money into research looking at periods and menstrual health, we do need to look at further tests that can be done for women in order to get an early diagnosis. But also as a society, we need to have those conversations. Instead of just saying, how are you? Maybe ask, how are your periods today?